Tuman masi cable TV clear to hypo po lang program hin kalolong do cheu voisuna impol pina inading hi Dr. Pushpakishore Maibam ania amahi MS ENT fellow head and neck onco surgeon ania tuhin district hospital posting district hospital Churchandpura posting be ania chun nilai ni le ninga ni hin duty huna ni chule chun avan hu puinum le abapan no hai ta ding chun nilai ni le ninga ni hin pan thei jenga ni ti chu he shil masani sin la chun voisuna impol tlang na e he de ding hin trong hi chithum trong pathum kan hum phang ding na e doctor pa hin me te trong le sap trong hum chok polata chun kein ka thei angin ashil ta sa hai kha atlang pui ma trong hin hung shil no ka ta question dang kan don mai Jujulation clear to high a doctor pahin hartong shi sino le khan sap tong le me te tong ai hung pol ding ani ti chu ka hung shil masani rosen. First of all, sir, thank you so much for giving us your valuable time to Manmasi Cable TV to know more about you and to create awareness about head and neck cancer. So for my first question, like, can you tell us more about yourself?
Yeah. Yes, first of all, I'm thankful to the Manmasi TV channel for inviting me and covering my interview. I myself, Dr. Maibam Pushpakishore Singh, I did my MBBS from Gujarat, and after that I did my MS ENT from RIMS Medical Science Imphal, and after that I was posted in District Hospital Churchandpur for almost 2 years. From 2017 to 2019, and after that I got selection for my fellowship in head and neck oncology, and after that I completed my 2 years course in head and neck oncology in Dr. B. Barwa Cancer Hospital. This is my brief introductions.
Yes, thank you so much, sir, for the introduction. And can you tell us more about like where you live in Imphal?
My present address is in Uripok, like Rembi Lekai. Just opposite to the flyover bridge, and that is in the center of the Imphal. So I will be available all the time over there. Apart from that one, I used to come to District Hospital on Wednesday and Thursday. So I feel like within these 2 days visit in District Hospital, the people of the Churchandpur should take the advantage of my expertise in head and neck cancer.
Yes. Today, how to pan a doctor pan hong shil kha district hospital sung hun hai hong shila chun ama inveng hi flyover ko line flyover che shi singa chun interview kan hei nei tak ma ka hei shil num chu vaisuna e thu shil ding hi apoi mo ma lule ring laya cancer chung chang ania ama hi specialized na chu ania chulei chun cancer chung chang shim akhom doctor in pana cancer and ring hel chun ingang stepam ingang investigation le tho tul hai mo khangai kha in ma tu ti hai kha kan hum shil ding ania chulei chun atu tu khom cancer elo ni no tam beng varna thua apoi mo lein hi interview hi abulai thoka atop chen lo ngai dingin ka hung feel tharnok cheu ni sinla chun as our topic, sir, is head and neck cancer. So can you tell us what exactly is head and neck cancer?
Head and neck cancers include a variety of cancers, and it's the cancer of the upper airway and the foot tracts. Apart from these cancers, there are some other cancers like the thyroid cancers. The thyroid is an endocrine gland which is situated in the lower part of the neck, and there are the salivary gland cancers, which is responsible for the productions of the saliva. So just to describe the head and neck cancers, I have to tell about the different subsides of the cancers. So head and neck cancers basically includes the cancers of our oral cavity, that includes the lip, tongue, this cheek, and it includes the cancer of the lower gingival sulcus. In Manipuri we call it yakong. That cancer comes under the oral cavity, and apart from this cancer, there are the cancers of the pharynx. In front of the neck there are 2 pipes, the anterior pipe, the front pipe, we commonly known it as a windpipe, which is responsible for the carrying the air from the nose to the lungs, that is present in the anterior part. And just behind that windpipe, there is another pipe that is responsible for the carrying of the food from the mouth to the stomachs. And this food pipe can be divided into three subsides, into three areas depending upon its locations. The part of the food pipe which is situated behind the nose, it's called the nasopharynx, and the part of the this food tubes behind the mouth is called the oropharynx, and the part of the food tubes that is behind the larynx, that is called the voice box, that is called the hypopharynx. So the cancer of these three subsides, and the cancers of the mouth, oral cavity, and the cancer of the voice box, that is called the larynx, which is responsible for the productions of the voice. These are all the cancers which is included in the head and neck cancers. Apart from that one, the cancer of the nose and the sinuses, which we commonly call as sinuses, that is also come in the head and neck cancers. And more than 90, interestingly, more than 90% of the head and neck cancers are the squamous cell carcinoma, which is a variant of the cancers of the head and neck, and it is associated with the use of the tobacco and the alcohol. So these are some of the cancers which is included in the head and neck.
So a doctor pana hungshil khat lom tin hungshil kata chun head and neck cancer hi in takamani ti zona ein do nakhan hi ei nuka hin food pipe 80 le wind pipe ti kha ma pipe pania wa chu chu nung ting da ma food pipe khan munthum a cheni no ka khalai munthum haya chidang danga khan cancer thaya chung hai khom athang sa chun thyroid hai khom ani a chun nose cancer sinus ting pa khai khom kha ahung thang sa bonga chu chun any laya a common big cancer pakata uma chu tobacco chu cancer chu hope le hum anole hi judon ti hai thil dang thil chano ai tho lak hai ai thok khan ahung tlung lakani ti ami shel be kane chu chun question anek adoda ding in hein don no kai ta tu da ko hin don ding hi ing aha umamana anole ing chanchin velam cancer chung chang hin kumingza mishim kumingza ni hai nam anne anole nordi sunga hin ingza percent cancer hi cancer hi anin voi lak ti chung chang hai kha ka huin don something ane. And to the next question, sir, can you tell us about the incidence and prevalence of the cancer?
Yeah, but so this is very relevant, and this is very interesting questions relating to the head and neck cancers. The head and neck cancer is the sixth most common cancer worldwide, and more than 55% of the world head and neck cancers are in the Southeast Asia. When it comes to the US, the head and neck cancers accounts for 3%, and in the Europe it accounts for 4%. But when it comes to India, of the total cancer in India, 30 to 40% of the cancers are the head and neck cancers. And according to the latest ICMR reports, that is the Indian Council for the Medical Research, out of this total 30 to 40% of the cancer in the whole India, more than 50% of the cancers are in the northeastern states. That means there is a very high percentage of the head and neck cancer in the northeastern states. Just to give an example, Nagaland is the highest is the highest place for the nasopharyngeal cancers. So this is about the incidence, and this cancer, it's more common in the male compared to the females, and the incidence increases with the increase in age. It's most commonly seen in the patients more than 40 years of age, but with the increasing use of the tobacco in the younger age groups, and because of the change in the dietary habits, these cancers we are also encounter in this younger age group also.
Yes. Today, Dr. Pana Hongshil Kha, India sumahin hi cancer head and neck cancer hai atam ma khovel pupuya khom cancer lai to aparuk na ani phaka hi cancer hi akomandan atam dan isira khana paruk na ni phaka chun India sumahin 30 to 40% vel hi cancer ne ni a chun north east to sunga eva fe no lem chun 50% hai cancer ama ha here he head and neck cancer le di a chu issue ta khan tobacco le hai dam kha ni a chun tobacco tlero lai thoka thildang dang hingai ti sikhare ti khai khom ni sin ai ngi khom lo ni ro sen khang hai tlero lai thoka I lo factor nai thokhan kum som li tung ting hin a huin langnum de a hul langnum de ta ati ne chun pasal negin no me negin pasal hin he cancer here an nei ron dem thu am sure to ani and for the next question sir can you tell us the causes of this cancer, the main causes?
Yeah, as I've already said, the most common type of the head and neck cancer is the squamous cell carcinoma, and it is most commonly associated with the use of the tobacco. In fact, tobacco is the male culprit for the causes of the head and neck cancers, and the tobacco can be in the form of a smoking form, that is we used to smoke, that is in the form of the cigarette forms, and these cigarette smokes contain more than 30 known carcinogens. And some important to mention are the polycyclic aromatic hydrocarbons. It's an important carcinogen which is present in the tobacco smokes. Apart from that one, the tobacco contain a very addictive substances that is called nicotine. So most of the patients after the consumption of the tobacco they find difficulty to stop the use of the tobacco. And this is the smoking form of the tobacco use, and the non-smoking form of the tobacco use may be in the form of eating pan, gutka, khaini, and this is also very common in the northeastern states. It may be one of the main reasons for the causes of the more cancer in the northeastern states. And the chewing of the tobacco, it's also associated with the certain pre-malignant lesions. What actually happen is like when we put and this chances also increases with the increased frequency use of the tobacco and the amount of the tobacco that we are chewing. So this is the in fact I should say like tobacco is the most main culprit for the causes of the head and neck cancers. And alcohol also acts in a synergistic fashion. That means alcohol itself doesn't causes cancer. I mean, it may causes cancer in some other site, but as for the head and neck cancers, alcohol doesn't causes cancer by itself, but it increases the risk of the development of the cancers when the alcohol is used together with the tobacco. So these are the two main risk factors for the development of the head and neck cancers. Apart from this, certain virus infections like Epstein-Barr virus, HPV virus, these are some of the virus infections that is responsible for the development of your nasopharyngeal cancers, that particular area of the food pipe that is situated behind the nose. So this area, this certain virus is responsible for the development of the cancers. Apart from that one, certain occupational exposures, those persons which are working in the battery plants, or working as car mechanics, or the person who is working as a wood carpenter. In these patients, there is also increased risk of the cancer for the development of the voice box and the hypopharyngeal cancers. Dietary factors also play an important roles. Decreased intakes of the fresh vegetables and increased intakes of the red meat. It's also one of the causes for the cancers. And the sedentary lifestyle. Most of the patients with the sedentary lifestyles, they are also at the risk of the cancers. Apart from this one, certain genetic factors is also responsible for the development of the cancer, which we have found in thyroid cancers. In the thyroid cancers, genetic factors play an important role, especially in one of the variant of the thyroid cancer that is called the medullary thyroid cancers. Of course, it play an important part in some other form of the thyroid cancer also, but it's mostly encountered with the medullary thyroid cancers. And certain immunosuppressions, like when our defense mechanism to fight the infections has been decreases due to the HIV infections, or the patients with the chronic kidney disease or with the chronic liver disease, where our defense systems of fighting the infections has been reduced. So in these patients, the chances of development of the cancer is high. And especially in Manipur, what I personally found is like when we compare to the Imphal area and the hilly areas, we have found the increased risks of the development of the nasopharyngeal cancers in the hilly areas. It's because of the increased consumption of the smoked meat. The smoked meat that we used to eat, it contains high amount of carbon particles that is rich in nitrosamines. So it's one of the main carcinogens for the development of that cancers. And the burning of the pine woods. And for cooking the food items, and in those houses in which there is poor ventilation, when we inhale that smoke also, there is increased risk of the development of these cancers. So these are some of the causes of the head and neck cancers.
And I have one question
please.
In that answer. Like the wood carpenters, you say that there's a risk for them to have cancer. So how exactly are they at risk to receive cancer? Mainly
the wood carpenters, they are associated with the cancer of the nasal cavity, paranasal sinuses. The exact causes, till now, the exact causes is not known, but the inhalations of the dust particles means when it collected into the sinuses. So with the gradient collections of this dust and all, this one, the clearance, because mucociliary clearance is decreases, so it ultimately leads to the obstruction and lead to the cancers.
Oleh tu ta ai Dr. Pan hong shil kha atlang pe ring in dilawin atlang pe hong shil kata tun hi pan le ho ni humai thu hai ship shima hin carcinogen ti uma hi cancer cause tu takadia pan hai khom ni sin good khai ti hai mo ing hai khom kha duji hai khom ni sin hi carcinogen hi le khan ai khop tam dan zir khan ami effect thaya chujun hi ngai nicotine ti boka nicotine cho ami suk addict tu ta kha abawai theino ikachiri ding ani pan ka chak chu kha khati abawai theino kha ta kha nicotine in form ani chujun atlang pin ai doctor pa da shil dan chu atlang pin hi plain areas infalting area le hi tlangram ting mo tlangram ting kar hin ai te hi chun cho tlangram ting ai tribal hai na ting pang deu hin cho hi ngang bowel cancer ting pang hi atam dema chu atlang pin hi voiting ai hun thak le hin atam lem ai doctor pa homin surgery lo tho ta laka kha khan atam lem chu hi tinga ai hum na khan cancer kha atamani ti hong shila chu chun cancer hi to lo khom carpentry work tho hai thing art anole thing tinga is fak zong na nei hai khom hi erikson sa ge me mal cancer nei na dingen asan chu aphit hai kha hi mark sa man lo in kha thano tu cho sinus ting na lut thaya kha ahung min kho so pha cho cancer form the ni ti ashil boka chun motor factory thok hai motor sim hai khom hi smoke ting hai anin nam la sekalo le khan ani ta dingin a chance kha aden zara le khan marks tho hai kha poi mo hi chun ei ni lai to smoke meat ei ki meya ei ur hai sa meya ei ur hai khom hi hingai khom in cancer form thaya chun tu lai lem to meya thai sung hi ei tam ta be no lai jingin pai nu de ki Christmas tree angai ha kha ei ro na arim akhu hung su khom khan cancer form the ni ti jo ami he sha sa bo kane. And sir, can you explain like particularly about pan kongkuva ai ti lakha kongkuva le pan ei fak shim ma khomin cancer form dan hi uma ai how to pahin me explain pe ding sin la. So about the pan, like it's very common in our areas. So everyone who is big or small, like we all eat pan, we all consume pan, whether it be zarda, mitha pan or komkuva. So we feel that the combination creates a good taste for us. But on contrast about cancer, like there's a different story. So can you please explain that for us in Meitei?
Quite a quarter of a matamda, quite manas the sunu taiduini, sunu siki mutay matunda muk, a quite a book jardamu hapsanduini, Rimatanda mukwamu hapsanduini. Sigi the mrap pull up, see this is a combo pack for cancer. Nasagi Nimbra Jarda Sina, Nasagi, Akwegi, Subsan Begi, Akwegi, Tingi Subsan Begi Changse, Yantina Hengalali, Adugi Mataktuda, Nasagi, Sunusina, Nasagi, Jarda Dagi, Amasung Quadagi, Nasagi, chemical carcinogens, cancer, course torrible substance Pamsbu, Hena Tadurope Helaldi, Aduga Subsan Basu Amuke Helaldi, Sina name, Sina ni, Akwing Nasagi Quatsa Bamida, Quick cancer, Adum Tui Bese.
tu ta hung chil ka atam le men shi thim ka zuring thawa to kuwa na ring hot lia sunoi thla na comment cancer form na ding he an sam ta ka kha chong khan kuvara e hesi no khan arenga an ko khan cho I cancer form da ding ha awin sang lem man man ani ati de nik em ni e tlang men nik em no ti ka eta ding a chano alo ni jinga khalai khan e lok kui em ke ko min tu chena hin ke lok kui na tam tak kanai ta chun alcohol ati zudon hai khom hi azudon hi akha chun chu cancer hi ava form no ami rok tu hi zarda pa nei ti thil dang dang hai zil hai le ai tho ko phin I lo in nikle sin khom cancer form na ding kha a chances asuk sam lem cancer any la ding kha atam asuk sam le ma zu le ai tho ko phong ta hin khale khan zu khom hi cancer kha din form no sin khom cancer form theina mangru pakhat vian ni ti kha hung shil sa bokani chun ado da fege ta cancer nei ding hin cancer nei ding ti lang cancer nei le nei no mo im symptom signs le symptom sei ti hai kha ing angina eng uma ano le eng ring hel dan ding kha cancer kan hi itina main ring hel itina ma ti hai kha I don no ding ni sin la and for the next question sir can you tell us about the signs and symptoms of cancer?
The signs and symptoms of the cancer depend upon the site of the primary tumors. Ngasagi akoigi cancer dugi maigi site dugi mafam dagi maigi signs and symptoms akoina khaidopi yai. If it is in the oral cavity cancers, the patients may present with a non-healing ulcer. Ayamana di ulcer gu mama tholuk tawbu kopa tawrasu means around 7 to 10 days ta means adum phagi. But if that ulcer persists for more than 2 to 3 weeks, and if it is associated with pain, and if it is associated with the bleeding on touch, and then we should suspect of something else. Then patients with the oral cavity cancers may present with the difficulty in opening the mouth. Normally, we can insert 3 to 4 fingers inside the oral cavity, but in the chronic alcohol and the tobacco users, because of that the carcinogens released by the tobacco, that makoina nebra koigi sidale riba koigi yari yakongi mucosa mayam se they destroyed, and it's been replaced by fibrous tissues. Whitish plaque, that is replaced by the fibrous plaque, and that causes the difficulty in opening the mouth. So it's one of an important signs of the pre-malignant changes in the oral cavity. If the particular patients don't stop at that moment, and if he continues to chew the tobacco, then he is probably going to have the cancer in the coming futures. In that case, in that persons, he might have difficulty in swallowing, and he may feel burning sensation whenever he eat any normal food item also, because of the changes he will feel like burning sensation in the mouth. So this is for the mouth cancers. And for the food pipe cancers, as I've already said, this is like a pipe. So the foods are going through that pipe. So if there is any growth inside the pipe, the patients may have the complaint of difficulty in swallowing. Chak sabada ma palakani. Chak sabada palakpase, initially it's for the solid mapangumagina hana palakani. Gradually, kasagi cancer dugi size tuna sumsum sakthro pagi matung inna maigi tube to block to bataradi, even that difficulty in swallowing yot pado, even for liquid ki food tasu adum hengalakani. So this is one of the symptoms for the foot tract cancers. And for the voice box cancers, the patients may present with the change in voice, makon sirak pa, makonda changes lakpa, that is also persisting for more than 3 weeks in a patient of more than 45 years with a chronic history of tobacco and alcohol uses. So this is in that patients we can highly suspect of the development of the vocal cord cancers. And with the advancement of the cancers, the patients may even have difficulty in breathing, presenting with severe stridors. So number serious condition. This is some of the presentations of the laryngeal cancers. And for the thyroid cancers, the patients often presents with the swelling in the lower part of the neck. Akoigi ngakta pomba gumba, just simple one poma gumba lapi ai, and that is the most common symptoms. Ayamba matamda adu patient adi khangande, manembra incidentally mana mingzen gumba yengu bakanda, manembra accidentally findings gumba toba, phangba natraga magi family members natragna magi friends circles na o nang isdi pomba male hire kanda khangba admaina oina ayamba thengali. Thyroid cancer gidi SS oina nembra yam kanda symptoms ti leite. Adu oirabasu akwai nembra thyroid cancers ki nembra chingnaba yabase karam kanda chingnaba yage haiba matamda ngasagi nembra iodine deficiency area akwai the Himalayan belt, we are most in the sub-Himalayan belt, so this area is prone to iodine deficiency. So iodine deficiency may be a causes for the thyroid cancers. And the childhood radiation exposures. Childhood radiation exposure aina hairaga, for example akwai Second World War da Hiroshima Nagasaki da akwai atom bomb thadagraga, because of that radiation exposures aduda hingoba angang myamda when they grow old mancha aduda makhoi gi nimra development of thyroid cancers lay. And aina ngasai mamang du haijagre genetic factors play an important roles. Ngasagi mama sida nabatar di magi machada narapegi possibilities to lay aduna thyroid cancer the family ki history hangba important oi. Thyroid cancers, thyroid the pomena loinma cancer oi ba habinate means in 10% mi tara pomda just in 1% the thyroid cancer oi bigi chances day. That means I mean yam kanna thyroid cancer habise yam kanna nembra common oi bidi natinate adu oirabasu oidena hairabasu akwai gi nembra atopa nembra rest of the countries ke yengnaba matamda Manipur dadi thyroid cancer is common oina oi.
So I'll just to tai Dr. Panahun Shilka ulcer ang zong comment to ta about dinga cancer ka aum thaya chun internal I asa I about na ya an khok am dawang da mai shi da no le I nuga thil lem har sa mo thil I bu fak da no le tui tak gil kam lem har sa kha tun apangai hai jo ni som ang vel hi om thaya ami ru jo kar ni kar thum ang vel jar jar ta chun jo kha cho I doctor hai pada ring hel thei ang zo na hun ta so da ni sir khat kha I point pa da hong shin da chun pa kha cho food pipe cancer kha anya chu ni chu food pipe kha cancer lo ni chu ahung len pe ya a cancer kha kha ta ka khan patient ta ding khan tui tak ngil khom le ma hui tak ta pha la kan ya chu a serious case de hai chu into khar sat hai da mo into khar sat hai da kha hum pa di ti amishila chu chun larynx anti a chu hi nu role suk na tak hi ta ka khom hin cancer om thaya chu cancer chu indina make shit thading signs and symptoms section na chun ani chu role hai da hung dam lama role pa ngai ta ke dong thei ta no a chung hai kham chu hi voice box ite la sa tom chun hi a role suk na tak hi ta kan thwa cancer hi anya pa kha chu chun pa kha da hung shil sa nok chun thyroid cancer om no ga thyroid cancer hi genetic side thok khama hi hung suk dok ani atia chu aum ji chu ti la ya thok khan Nagasaki le Hiroshima Indopui la ya bomb antha kha radiation uma chu kha effect kha Japan thing highland to antur na sa ma now high an now high pa ping sul commander tama voice of ni jen hin kha any even nai do le kha radiation de khom han aum the ati ni cho genetically atia khan I an sum le ku high an lu le pa high pi high mani an lo le chun an nei na chance hong kha alo le khan kha family history in dong kha apoi mo thu hong shila chun iron deficiency le khom ani thai ti ai chun thyroid cancer om thei nok na san kha chu any Himalayan belt la ya umenia chu ji Himalaya tla hai kol lai dewa umenia hi taka nu hin iodine hi atla sam ma G80 mo tia thil poi mo kha atla sama kha le khan any ta ding hin thyroid de kha ang ol samani ti chu amishil sa bokane.
And one of the important presentations of the head and neck cancer is the swelling in the neck. Swelling in the neck play an important prognostic value in the head and neck cancers. For example, if a patient with the cancer in the mouth, means for that particular cancer, if there is a spread in the neck and if the patient presents with a swelling in the neck, then the survival is almost reduced to 50%. That means that means if a person is living for 10 years, then he will be reduced to 5 years only. His survival will be just reduced to 5 years. But if that neck nodes appear on the contralateral side or the opposite side, for example, if the cancer is on the left side, but the appearance of the neck node is on the opposite side, and if it is confirmed for the malignancy, then that 50% reduced is again further reduced to 33%. That means there is very important implications of the neck swelling in the head and neck cancers, since the head and neck cancer is rich in lymphatic supplies.
So does it mean like it is more dangerous if it's in the opposite side?
Yeah. Because like if in the same side, survival is reduced to 50%, but if it comes to the opposite side, then the survival is reduced from 50% to again 33%. That means the prognosis is more further worse.
Yes. Tuta Dr. Panong Shilkha thyroid tung chang hi apung laka ani chuchun thyroid na zong hi cancer ani wong chung achen hi cancer ani thuring odana tuta hing shil chu cancer alo ni chu tun ai bawa hi gums lai vela cancer alo umani chun kha aspreda apunga hi lai atnui thyroid chana ba apunga kha po apuma mu chun hi taka ai survival 88 dam chending kha percent som nga in atlanui atini chun hitting pum lawa hinting a pum nok chun 33% atlanui no ka chum ji chu hinting a cancer ne ka hinting a pum lem no ka ni chu e dam na ding chance kha atlom le mani ti amishil ne. And so sir, about the signs and symptoms, we have talked about many signs and symptoms. So what if we have a headache for a long time and it doesn't go away, and in our place, especially for our community here, it's very much common that we eat painkillers like Saridon, Control, and anything when we have a headache. So what precaution do we have to take about that?
Actually, as such with the head and neck cancers, means headache it's not most commonly presented. Of course, means with the certain subtype of the cancer, for example, with the nasopharyngeal cancers, with the nasal sinus cavity cancers, the patients may have headache, of course. Because the nasopharynx, it's just near to the skull base. So, because of the tumor spreads to the brain, the patients may present with the headache. So in that cases, headache will not be the only symptoms. Of course, there will be the symptoms for the nasopharyngeal cancers. And if headache is there, then we can think of like spreading to the brain area and all. And even for the paranasal sinus cancer also, because of the chronic obstructions of the airway patients, the patients may have some kinds of complaints of headache. Apart from that one, I don't think like head and neck cancers really presents with the headache.
Tuta Dr. Panong Shilkha question kan don khacho inila hindu na mai ti haida ni atam ma hitaka hin painkiller hai na sok na hai fa ka chu ahung shildan chun sinus lei khomina na theya anole thuka cancer lut lei khomina na theya ami ro chu atlang ko chun luna cho hi asymptom ani kher mai no ti thomi shilania chun adoda pheno kai ta investigation chung chang hin don ta investigation ai ti chun doctor hai ba kana cancer digin aim ring hela ka chunga agam step la ninga truti hai kha amin shin pe di kane. And to the next question, sir, we'll talk about the investigation part.
For the patients with the head and neck cancers, there are certain basic investigations we used to do. First of all, we need to elicit the detailed histories. Means we have to ask to the patients magi symptoms ahamba karino, and how long the symptoms has been there, and we have to ask about the history of chewing tobacco, alcohol, and we have to ask about the histories, about the positive histories of the cancer in his or her family. So these are the chief histories that we need to ask to the patients. Apart from that one, if there is an oral ulcer, if there is an obvious growth, we will take a biopsy from that particular area and we will send for histopathological examinations. If there is an obvious neck node, then we will do FNAC. Normally FNAC, what we do is like we insert a needle and after that we draw some of the sample from that particular swelling and we assess for the presence of the tumors. So these are some of the method for the investigations. And of course, if the patient has the change in voice, we used to go for the upper GI endoscopy and we assess for the presence of the tumors in the airway or the food passages. And one interesting point where here I just want to emphasize is in head and neck cancers, the possibilities of being a second primary tumors is around 5 to 10%. Haibadi primary cancer ama akoi gi nimbra oral cavity de lere atopa site ta cancer ama gi second cancer atopa site ta lebigi possibilities to lay adugi percentage to around 5 to 10%. See or pegi chances se kari gino haibada there is a medical term called field cancerizations. Field cancerization na harisina akoina nimbra kwa cha ba natraga akoina nimbra khaini umbada akoina tin yosan gi bado that saliva containing the that tobacco carcinogens is exposed to the whole tract, so the cancer can develop anywhere in the whole tract. Aduna sida cancer ama lerga atopa jaga da cancer ama lebegi possibility su lei aduna we have to rule out the presence of the another cancers. Aduna akoina upper GI endoscopy ama tawani aduda akoina karigumba chingnaba cancer gumba growth level tardi adurigi biopsy ama lawraga akoina test thadokani sisu investigation makhala mani aduga akoina imaging da akoina CT scan natraga MRI natraga even PET scan bo koi tawi just to assess ngasagi cancer do ngasagi leiriba mafam du leibra natraga atopa jaga da sandokraba haibagi yengnabagi makta akoina nembra staging tawi aduga sigi nembra hariba investigation myamsi da pula punjalaga akoina nembra ngasagi cancer dugi maigi nembra staging akoina calculate tawi manza adugi nembra staging dugi matung ina akoina muk patient dugi treatment tawi. Of course karing ba akoina patient do operation to bigi plan to butardi basic maigi investigation akoigi liver function test kidney function test atopa blood test myamsu tawani.
To ta e doctor pan hongshil kha tlom kin hongshil fi kata tun i doctor eba pana cancer in drink hela ni chun chu an history min don ta family han cancer lo ne da man mam ti hai dam a insunga chun khai ni ti hai thil hum hop ne hum hai kha e tho am ti hai min don ta chun bawa cancer bawa ana ni chun chu biopsy ti hai hun lai bel khamin la tir ta chun thyroid da man ni chu thyroid da khan i atui thila to ka kha test tho dam kha hum theya chun i khai ni hum le no thil hum le da ma lo ni chun chu kha cancer ka hun khata chawni lo hun tam danga umna ding chance khan sang e ma chu ingle ya mai ti chun khai ni hai hum khan eitil khan a dissolve on it eitil khan umwa kha carcinogeneity na kita cancer form tu kha e heldem anole e khat e fak bil khan mundang dang hai kham alo form the a cancer ka hun khata chawni lo bin chu hai kam cho e en na ding khan CT scan MRI lak ti hai adang dang hai kha thosa ani ha ti amishila chun operation ding dam cancer alone ya operation ding ani chun kidney test ti hai le thil dang dang hai kom kha lak sa pe ni
aduga koi thyroid cancer gi basic investigation haiba taradi akoi nambra ahambada thyroid function test ama tawni aduda akoi test tawi se thyroid na produce over important hormones only T3 T4 TSH haiba hormone kara sigi hormones haiba thyroid na produce over hormones se akoi gi daily day to day activities ta akoi gi nambra yam thina important roles nei aduna sigi nambra ahambada test tokoi ngasagi thyroid function test da normal natraga low oiba mida ngasagi cancer oibagi chances wangi aduga thyroid ki function test ta high oiba kangu dadi ngasagi cancer oibagi chances nemi aduna first ta akona basic thyroid function test ama tawgani adugi mathang da ngasagi akoina ultrasound ngaki ama logani ngasagi thyroid to just ngasai pomido just one side ra natraga thyroid ki atopa side su lebra natraga ngasagi thyroid tudang nataba atopa neck area da apom lebra haibagi check ama toraga with thyroid function test ama tokani karigumba thyroid akoina nembra ultrasound da akoina karigumba chingna bu khotpa leiba taradi akoina nembra ngasagi apom degi akoina yetum ama thilaga in ngasai haijagi bido FNAC toraga adugi test toraga thyroid cancer ra not tabra habido adu confirm tawani. These are the basic investigations for the thyroid.
Chun tu ta koi mo epi mati cho thyroid cancer abik tagi thyroid cancer ami kha tun basic thyroid test tho ko da ta khatagan ultrasound hayan laka juju taka atula ti ni chon nikita ashil ta sa inna nidila asunga mi lam to ka test thoa khanga ga investigation ka thoding ani ti thua mi shilale. And for the next, if in case the patient after doing the investigation, after all the investigation is done, and you find out that it is cancer, so how will be the process of the treatment?
The treatment for the thyroid cancers depend upon the stage. So from the investigations, we will be able to come to the clinical diagnosis and the staging. And in any cancers, there are 4 stages. Stage 1, Stage 2, Stage 3 and Stage 4. Stage 1 and Stage 2 are the early stage cancer, and Stage 3 and Stage 4 are the advanced stage cancers. So for the early stage cancer, there is Stage 1 and Stage 2. We use a single mode of treatment. Early stage we use a single method of treatment. We can go for surgery to be natraga radiotherapy but for the advanced stage cancer, Stage 3, Stage 4 multiple modality of treatments required. And the options may be option choose to it depends upon the size of the primary tumor also. For example, oral cavity, first we go for the surgeries. Biopsy report whether the patients will be requiring radiotherapy or the chemotherapy, we judge and we give. For example, foot pipe cancer voice box cancer these sites are not easily feasible for surgery. And moreover, like voice box the patient won't be able to speak the lifelong. And moreover, there will be a permanent opening in the neck. So just to avoid that one, first we try for radiotherapy and the chemotherapy. Aduda karigumba fagradi fare natraga aduda phattaba lehoba natraga amuka cancer halapatardi we go for the salvage surgery. Aduda di akoina ngasagi voice box to aduda akoina laktoi. So these are the different methods of the treatments for the head and neck cancers. And one important things about the treatment of the head and neck cancers is see the multiple disciplinary doctors ki expert ki opinion darkatai. Amakitang na nembra ay head and neck surgeon ne harga ay head and neck surgeon operation loktoga adum operation loibinate adugi matangda maigi amu radiation pini natrogi chemo pini habigi adugi field labor expert mayamgi doctors mayamgi opinion sudar katai aduna point aina labor hospital aina cancer dropa matangda manjo we have got a tumor board in which the expert of doctors from different fields we discuss together and try to give the best treatment options for the particular patients. And this is in this way we treat the head and neck cancer patients.
Tuta a doctor panahong ki ka treatment labding hen ay shin masataw din to a stage manati kanya tun cancer ni stage pakat pani pathong palina chena uma so stage 1 de to hi ala naw pang dewa a cancer ka ala serious tak no ti a serious rising khan a sheet seng ta thawa chu lai chu jun 30 40 advanced stage ani a chu jun hi hinga hi surgery tun muthei chin bawa mi dam ju surgery a thothe nya chun muthei lo chin hai dam kha serious dan du ju radiotherapy le chemo khai eti ka chemotherapy hai thothe ani a chu chun at an the ang doctor hai comment tun voice box la ya ai role na la ya cancer lo umani chu ka an ke doctor jo role ni tan wel ding na kha ma khan na sa ta investigation hai an tho a chun doctor pakhat tuta voisun yai discuss jo lule ring chungcham abik tagin hi chungcham char hi ania kha an tho ding ani khoman lule ring doctor chon lo doctor dang hai mu comment discussion khatak negin ma lak chon lakani. So for the next question, sir, we have to talk about the treatment therapy, and after taking the treatment, the patient is, let's say, healed. But there is a chance, like usually we have experiences like after one patient is healed, then it comes back again, like there are lots of stories like that. So what would be important after being healed from the cancer?
For that comes the role of our follow-up. Follow-up is a very important part of the head and neck cancer management. and from the follow-up, from the regular follow-up, we will be able to detect the early reappearance of the cancers or the presence of the residual tumors. So in head and neck cancers, most of the maximum recurrence or the reappearance of the cancers after the complete cure of the cancers, this recurrence or the reappearance of the cancers occur in the first 2 years after the completion of the treatment. For example, if a patient has received chemotherapy or radiotherapy and he has been declared completely cured by 2000, then within this 2022, these 2 years is the maximum cautious periods during which the chances of reappearing of the cancer is very high. So in this 2 years period, we follow up the patient very rigorously. We follow the patients every 2 to 3 months, and for the next 3 years, that is from the 3rd to the 5th year, we follow the patients every 4 to 6 months, and after the follow-up of the patients for 5 years, if there is no reappearance of the cancer, or if the patient is totally okay, then we follow the patients every yearly for the rest of the life, because in the remaining part of the life, he or she can develop the cancer anytime. Of course, the chances of development of the recurrence of the reappearance of the cancer is less, but he is still at the risk when compared to a normal person. So once a patient is affected, people should be followed up for the rest of their life till the patient survives.
Atuta Dr. Panhongshil ka apoy mo mahilay takhi tun cancer an thokin idam ta aniti le rung khan dam vong ta tina ni wa tun ahongshil da ta ka chun voi khat cancer voi ta cancer na ani ta chun cho dam sung khan cancer ahong ki no na ding chance ka an sa mi pang ngai hai ne kin hale khan in vakan no follow up ela doctor hai an khat to ka dam no tam ve engine ka apoi mo mati ni hi follow up patient hai follow up an nei na ding doctor hai kham bi apoi mo ma chun kum hi sung hin atlang puin ahung in nam no ma de cancer hi adam ta 18 no hin chulai chun kum hi sung kha cho film khor takin regular dawa patient hai ka va encouraging le an wala patient hai doctor hai ve engine ka apoi mo chun kumngan nung ting hai khan cho regular takin checking ka an thota no ami rup cho kumtin chun cho follow up hi nei jing apoi mo thu ami shin tu ta do da ko hin don no ding hi prognosis ti ani a chu patient cancer ai ma tahin incenam dam ding an no le an na tan kha ing anga mani ti kha en kai na ha ni do ta ka chu chung chang chu hin do nei ta. And sir, next, can you tell us more about the prognosis?
Yeah, the prognosis of the head and neck cancers depend upon the stage of the tumor. For the early stage tumor, that is the stage 1 and stage 2. When we talk about the survival rate of the cancer patients, we usually talk about the 5 years. So for the early stage tumor, the 5-year survival rate, it's around 60 to 70%. But when the cancer progresses or when the patient is in the higher stage, this prognosis is reduced. For example, for the stage 4 cancer, that 60 to 70% prognosis in the stage 1 is reduced to 20 to 30% in the stage 4 cancers. So from this stage, we will be able to have a rough idea about the prognosis and how long the patient is going to survive.
Tu tai Dr. Panhongshil ka prognosis chung chang khan tun cancer hi stage 1 vela in mataka musu kan chun cho andam suk na ding kha chance atam ami rup cho last stage 4 high ahuni ta khan cho andam suk na ding survival rate ka atlong he thu ami shilane. And for the next question, how can we prevent this head and neck cancer?
For the prevention of the head and neck cancers, the most important things is like one is the avoidance of the risk factors or the factor that causes the cancer. As I've already said, tobacco is the male culprit for the head and neck cancer. So the complete abstinence or the complete stop pace of the tobacco drastically reduce the development of the cancer. And in all the in the patients who has been already treated for the cancers, that particular patients, when he avoid the this tobacco completely, then the chances of reappearance of the cancer is also very much low. So we should prevent all these risk factors, like we should completely avoid the tobacco we completely avoid the smoking. And we can increase the intakes of the fresh vegetables. If I've already said, increase intake of the fresh vegetables, increase intake of fruits, and decrease intake of red meats. We should make ourselves involved with physical activities. We should avoid the sedentary lifestyles. Of course, there are certain antioxidants like your vitamin A, C, and E. This will increase intake of these vitamins has been associated with preventive roles against the head and neck cancers. And of course, early screening is very important. If there is any cancer in the oral cavity, and with the early screening, if we have detected in the early stage, then the survival in that particular and the prognosis in the particular patient is also good. So these are some of the preventive measures that we can take in the head and neck cancers.
Tuta ho to pan shilkha cancer hi a prevent landing chatak chu a point pakhat na hope le hum thi hai he insum to pia tha in khom lo ni si sudon hai khom hope le hum hi insum to pia tu la chun patient pakhaden hinga nga thole ya cancer lo ne ni ta chun chu zo chun ansum to bani chun chu cancer hum kir no la ding kha acha chat lo mani la ti ne chun apan hi na ading chun khai na ring hai fa ron acha chun red mi de ti sa ring ti hai he fa ron lo hi acha ami ti pek boka chun apathum na adingen taksa in soi na la ron hi apoi mo mate boka chun atop na takading chun screening 80 tun imani inga imring tel na nole apum dam ti te dam ni hi am chun cho doctor vapan vada imani ti kha va en kai vat kha apoi mo ti thua shila asan jo na ki tai shil tang khan early stage khan an mati nga mu su chun adam na ding kha a chance an sang ani thua mission boka ne. And also, sir, like we find cases where there are patients who doesn't take any tobacco, who lead a good lifestyle, but they are still infected with cancer. So there are some people who says like, even though I take cancer, till today I'm not infected, and there are someone who didn't take any tobaccos, but they're still infected with cancer and they die of it. So what could be the reason?
That's a very good question. First of all. That cancer development, it's not necessary that means those persons not taking tobacco will not develop cancers. Of course, the chances of development of the cancer is there, but when you compare to a particular person who is a regular user of tobacco and alcohol with the other one who is not using with the tobacco, who is not using alcohol, tobacco, when we compare the ratios, the development of the cancer in the tobacco users will be always high than the one who is not using. It is rarely exceptions like the one who is not using tobacco may develop cancer. It's not only for the head and neck cancers, it is applicable to all the type of the cancers. For the cancer development, it depends upon the genetic makeup of the tumors. It depends upon the genetic makeup of that particular individuals. For one particular patient, he may be very much tolerant to that particular tobacco, but for the another person, he may be less tolerant to tobacco and he may be very sensitive. Even with the use of small amount of tobacco, he is at the risk of development of the cancers. So it's not necessary that the one who is not using tobacco will not develop tobacco, but of course it's the fact that the one who is using the tobacco, they have higher chances of cancer than the one who is not using the tobacco.
Tuta ho tu pan hun shil kha atra ema tu hin cancer hi tobacco fagle to ni lo khamin hi thil dang cancer dang ading khom ni sin hop le hung tholo hai khomi an na thei tho ti kha ingle ma na ti kha ka zo na ni a chu ami don dan chun thil hop le hung le thil zule sa tho hai le tho chak lo hai he compare chun cho a tho hai he an na sabi ka de ana hi an tam bi ka ne in khom tholo wa cancer tho hi cho wang khat te ne ti an khan a chance ka atloma kha cho entirna pakhat mi pakhat pati vel to ka mu thei ding an umlak atia chun any genetic ting pang ami shim izir khomani ami shim ei tak sa tha le shan mo izir tun mi pakhatin I hop le hum tam tak alo thoa kha atak san azo the anole mi pakhatin tlom ti athwa mi ru tak san azo no to ti kha mi shim dungzui mi shim shi sian na izir ani ti to ami shi sa pek pokade. And for the next question, sir, there are a myth, like a belief saying that once you have cancer, you will die. You know, like it's like hell for the rest of your life. So can you explain for us about that?
The cancer, of course, it's an evil. This one we should consider as an evil disease because no one wants to suffer from cancers. Because when a person develops cancer, it's not only the persons, but it's the other family members also that got affected. It's not only the this one, not only the emotional or the physical state of mind. It's since the cancer treatments involve a huge long durations of treatments, so there is financial involvement, and moreover. We, the peoples of Manipur, have a tendency to go outside. If we detect any cancers, they don't believe over the doctors over here, so they prefer to go outside. So that kind of things may be a burden to the patient's party also. And moreover, like when they go outside also, there is a language barriers also. So these are all the factors that have a negative impact on the cancers to a particular person who is suffering from the cancers. So I just want to tell that this one, if a patient develop cancers, it's not necessary that that particular patient is going to die sooner or later. If we detect the cancer in the early stage, in the curable stage, we can cure the cancers, and after that we need to follow up the patients for the rest of their life, of course. But it doesn't mean that a patient suffering from cancer will die. So we should change that concept of mind, that and we should try to boost up emotionally as well as emotional support is the most important, because when a particular person suffers from cancer, a lot of negative feelings comes in mind, in our mind. So I think like all the family support, not only the family supports, but the rest of the other peoples around him should support him and should encourage him, like nothing will be happen. This kind of attitude will make a difference in the treatment.
In Dr. Pan, amishil katun kazona ka cancer mi phat cancer le tahin jo athiding si ne si top laka hi andikam thilthani ti kandona I amishil dan chun tuta ishil ta angkhan I cancer na zong hi anthimong ding ti na ni no ami rup jo I andam sun chun check up hai khanga fe jo atu zinga chun cancer hi har sat na jo taksating jo na ni lovin lungril ting le ngai tu na ting khom afang na sa ma chun anatu pa jo ni lovin anatu pa sung le ku hai khom effect phak vong ani chulei chun mi pakhat cancer na ta chun paisa ting khom ni sin ngai tu na khom ni sin insulin and kol ting khom ni sin effect phak vonga ami rok cho khakhata ka khakhalai khan ani hain cancer nei hai kha ai support shat tak le hui takin ro eti lakai chong chun khanga supporting pek mo khanga eva thatona hai eva pek kha apoi mo em thuami shil boka chun cancer nei leiring oda thiding ti hi cho ani chong no ti kha ashila in mataka ai mu the ni chun cho dam na ding chance kha ala tam ti thu ami shil boka ne. Okay, so sir, for the last but not the least, can you just leave a few words of advice for the audience who are viewing us?
Yeah. Since our topic for today is the head and neck cancers, and me being a head and neck oncosurgeon, I just want to emphasize on the use of the tobacco as a main causes for the cancers. So I request to the people, if possible, if not possible, it's a compulsion for everyone that tobacco, the habit of chewing tobacco should be stopped at once. And what we have seen in our daily practice is like this. Previously, these cancers was considered to be a cancer for the older age groups, more than 40, more than 45 years. But because of the increased use of the tobacco among the school-going children, around 12 to 15 years, because of the excessive use of the tobacco in different forms, there is increased incidence of the cancers among these groups. And when the cancer develop in this particular age group, the cancers tends to be very aggressive. So it's my humble request to all my viewers and to the people of Churchampur that we should avoid the habit of using tobacco. Plus, we should not panic once we have cancers. Of course, it's quite natural for everyone to be panicked when we are confirmed with the cancers. But if we detect the cancer in a very early treatable stage, then it's curable. So we should not bring the negative thoughts that cancer will kill us. Cancer is it's an evil, and we have to fight this evil, and we should overcome this evil. So with this, I just want to thank.
Tuta a doctor in Zaum tagin ahong shiltu clear to mi pui hai kancanum in ngai tlom taka kancanum tu hi ani a hop the home zule sati ha hi ate shamchun top to make you a top hi ta dinga cha dia mishila dia min cha chun cancer hi kum som ti chung ting hai ta ding bika ac kha tu lai rama hin cho kum som ni nuiti clearol te hai hin cancer hingang cancer hi an hung nei ta khalai kan thi na khom atlung na sa ma chuchulei chun abik tagin Churchampur mi pui hai kan chanum tak zet cheu chu hi hop le hum ting hin naw pam khom disin apui tling ting khom disin hi top to make you generation changthar hai khom intuk tera hi cancer an loading in changna sa tagin langai tiu ti chu amishela chun cancer NET a shi ching ha le cho lungril buina no le lungril so na emi a de laka hi thil fedan ding pangai reng ania ami rup cho hi cancer hi a hu tok vadani chun cho hi sukdam the ni le yin mi pui cancer a lo ne ni khaman hi chithong lova hi chataka doctor hai pana step hai la ding in e ka hung feel bok che wani ti ami shin ande. Okay, sir, thank you so much for your time that you have given us, and your sacrifice for the people is very precious, like the awareness that you give about head and neck cancer. So I hope that even the viewers will benefit from this talk that we have, and then at least a group of people, or like maybe who knows, lots of teenagers through this talk will change their bad habits of consuming these tobaccos. Thank you so much, sir.
Thank you.
Kapawakan Dr. Pushpakishore le ain pol na chu he to kaita voisuna interview aminei pe ki ailom tak zeda ama khom ke in ka hlok puiding in khom no ami ruk chu mi pui hai kuma ka he shilnum kan chanum chu hi thu hi cancer hi tobacco na form ania hoble hum hai na form hoble hum hai hin I antluna dia chu le chun thing ha hi top thei shamin la kanum talua mi pakhat pani bek hi habit chalo hi hoble hum ching jong sakhai I kasuk top theya ka thushila ain thoka anlo pingthar anlo thasuk thei ani chun chu kalom hle ani ti in interview ha hi lom takin ahunlu takhai hung sengin ami nei peka achunga atharin lom thuei shela pathinin malsom chinla matinga khom I ni mi ta ding le midam dak ta dinga I malsom na ni a sukdam tu ni nge ding pathinin mangjing sin ti indi sakna e hein hlan ni rosen ole covid la ya lenge ni a covid khomalabo no a chulei chun ai suk phat phat le khom mask le hand sanitizer hai kha mangtheng hi lovin mangsun zom pe tiu ti chu ai hung shil tharnok ni rosen clear to high video thara in manok sengei tiu kan lome